Hi, everyone. Welcome to Webinar Wednesday. I am your host, Kia, and I want to thank you all for joining us. Today's speaker is Dr. Davidsohn, and she is going to cover how to manage and recognize and give information on diabetes. For some more information about our speaker, feel free to visit Kelsey-Seybold.com. Dr. Davidsohn is board certified by the American Board College of Internal Medicine. She currently practices at our Cypress Clinic, which is one of our newer ones. She has been with Kelsey-Seybold since 1999, and her career interests include hypertension, diabetes, and women's health. As a reminder, we'll be taking any questions you have at the end of the presentation. If a question just happens to pop up, just type it in your question box below, or if you're using the app, under your question tab, and we'll do our best to address each question at the end of the presentation. And with that being said, I will now turn it over to Dr. Davidsohn.
Thank you, Kia. Hello, everybody. Trying to get situated here. I'm Dr. Carminia Davidsohn. I'm one of the internists at Kelsey-Seybold Clinic. I work at the New Cypress location, which is located on the corner of 1960 and 290, northwest side of town. I've been with Kelsey, as Kia had mentioned, since 1999. Take a special interest in diabetes and hypertension and women's health. Right now, the webinar, since it is Diabetes Awareness Month, is Diabetes 101 management, and we will add a little bit more regarding diet somewhere between the slides. So sit back, have your lunch, and enjoy our webinar. So what are the basics about diabetes? Basically, pathophysiologically, diabetes is when you have high blood sugar. And it is the inability to control and utilize sugar. This goes to because of the different ways of how the body utilizes sugar, and I will mention about the two types of diabetes in a later slide. Food, when we take in, is converted to sugar by digestive processes. The absorption and digestion of the food that we take in is actually triggered or controlled by insulin, which is secreted by the pancreas. Insulin is needed to enable sugar to enter cells. Sugar is actually needed to be utilized as energy. If the sugar can't enter the cells or glucose molecules, it remains in the bloodstream. And if you have diabetes, you have high sugar readings or glucose molecules floating in your bloodstream. Okay, and there are two types, and two types are based on the fact that people may be low or deficient in insulin. This is what we call insulin-dependent diabetic patients. And you do have also insulin in the blood, enough of it, but you can't utilize it because there's a problem with the recognition of the insulin on the cell wall. And these are patients who are type 2 and are insulin resistant. So over here is we have our flow diagram of a healthy person versus a diabetic person. On your right is the healthy person, okay, and this is our pancreas right here with a smiley face, releases insulin. So when you eat something like sandwich, for example, your glucose comes from your food products, mainly the carbohydrates, which is your bread. These molecules or glucose molecules are supposed to be used as energy, and they should be entering the cells by the help of insulin. Okay, in a diabetic person, this process is hindered or affected if, one, you don't have insulin that's released by the pancreas. Therefore, these glucose molecules cannot enter the cells, and you're tired all the time. This is what happens. Your glucose molecules stay in the bloodstream, and therefore you have high blood sugar. In time, the high blood sugar damages the nervous system and the other organs. One of my favorite organs that's affected is the kidney, and it can lead to serious health complications if left untreated. In the case of kidneys, kidney failure, ending up in dialysis later on. There are two types of diabetes, as I mentioned earlier, type 1 and type 2. Type 1 diabetic patients have low insulin levels or no insulin, and you end up needing insulin shots. And then the other one is type 2 diabetic patients, where you do have insulin in your bloodstream, but the cells do not recognize the insulin, and therefore the glucose molecules are just floating in your bloodstream, and you don't have energy in the cells. So in effect, these patients actually have symptoms of fatigue from low energy produced by the cells. So type 1 diabetes is usually diagnosed in children and young adults. It is also diagnosed in adult patients, older than young, when in their 30s or 40s, when we do specific testing. About 10% of diabetic patients are type 1 or insulin dependent. We also call it juvenile onset. You have what we call a pure insulin deficiency. It is actually caused by autoimmune destruction of the pancreatic cells that produce insulin. It is treated with insulin shots or the pump. On the other hand, you have type 2 diabetes, and these is the more common one. 90% of our diabetic patients in adults have this. Okay, it's usually due to insulin resistance, when the insulin is there but cannot be recognized by the cells. It is related to obesity, and you do have a strong family history of type 2 diabetes, and racial predisposition. Patients who are African American descent, Hispanic, Native American, and Asian Pacific Islander. So type 2 diabetic patients are linked to high cholesterol levels, high blood pressure, sedentary lifestyle of lack of exercise, overweight or obese, high fat intake, and smoking. What does the term prediabetes mean? Okay, prediabetes is when your numbers, and I'll show you it later on, the A1C or hemoglobin A1C is up to a specific point, but not to the diabetic range. What it means is, when you're given the term you're pre-diabetic, is that you have a chance to revert that condition and become normal, therefore preventing yourself to progress into becoming diabetic later on in life. The body is having trouble getting blood sugar levels down to a healthy range. It may be because you are overweight and you are not mobilizing your sugar because you lack exercise. It may also be because of your diet. So how to change it is some healthy lifestyle changes. Hopefully you won't develop diabetes later on. What about gestational diabetes? Gestational diabetes, as the term means, is when you develop diabetes when you're pregnant. It is basically abnormally high amount of sugar in your bloodstream. Most women with this type don't remain diabetic after the baby is born. But we have to be very careful, because it is after 5 to 10 years after your baby is born and you don't change your lifestyle that you can become full-blown diabetic. Keep in mind that women who have had this type of diabetes earlier on, as I said, can develop it again during future pregnancies. And as I said, 5 to 10% of these patients can develop type 2 diabetes later in life if they don't change their lifestyle. So what are the common risk factors for diabetes? You are over age 45, you develop gestational diabetes or gave birth to a baby that was over 9 pounds, you lead a sedentary lifestyle, you are overweight or obese, you have a family history of diabetes, you are an African American, Hispanic, Native American, or Asian American, and if you have prediabetes. So diabetes risk factors, as I mentioned here earlier, is all about this, but also when you have high blood pressure and high cholesterol levels, you may actually later on, if you don't change your lifestyle, end up with diabetes. But one of the more important things here that we cannot change or alter is our family history. I occasionally counsel my patients and say, if both your parents have diabetes and you now are pre-diabetic, what you cannot change is that you have the predisposition of becoming diabetic later on in life. Okay, here now we have the signs and symptoms of diabetes. How do you know, or how do I know if I have diabetes? Early in the course of the disease, you don't have any symptoms and you're like a walking time bomb here. But then later on, as you go for your yearly annual physical exam and we do fasting blood sugar, if your numbers look somewhat like this, and let me explain a little bit, then you may be either diabetic or pre-diabetic. Normal blood sugar fasting is less than 100 or 99 when we do it with your exam. When your numbers are 100 to 125, that number is pre-diabetic. You already know that you have to change your lifestyle. And if your fasting sugar is more than 126, you are diabetic. We also use the term hemoglobin A1C. And for those of you who are familiar with this number, hemoglobin A1C is the average of your sugar over the past 3 months. If your number is less than 5.7%, up to 5.6, that is normal. If your number is between 5.7 to 6.4%, you're pre-diabetic. And if it's more than 6.5%, you are diabetic. Just tells us for the past 3 months that your sugar has been running high. So what are the symptoms to look out for? Going to the bathroom a lot, frequent urination throughout the day and at night, always thirsty but you can't seem to quench your thirst, always hungry or ravenous is what we say, because you can't keep up with the increased demand of the cells because the sugar can't get in to be used for energy, therefore leading to weakness. You're always tired. And then again, weight loss, because despite all the food that you're eating, these sugar molecules are not getting into the cells and therefore you lose weight. A lot of our patients, when they come in and complain of symptoms, they tell us, I don't seem to focus my eyesight or vision. Blurred vision is definitely one of the symptoms that come up. And I also tell my patients is don't even go for an eye exam until we get your blood sugar controlled. Some patients come to us because they were referred by the optometrist and ophthalmologist because their prescription for the eyes or their glasses have changed dramatically, or there seem to be just blurry vision but can't seem to be supported by a change in their prescription for eyewear. And then that's when we suspect that they may be diabetic. People who are diabetic and don't know it may be nauseated, okay, and they have slow healing of cuts and bruises, and then you can have tingling in your hands and sometimes feet. What is not mentioned here is headaches. Headaches is basically one of the more common symptoms of diabetes. So why do we have to be checked out yearly or when you're having symptoms? Because we want to prevent the complications of diabetes, mainly heart disease, stroke, blindness, kidney disease, infections, nervous system disease or what we call neuropathy, blockage of peripheral arteries or what we call peripheral arterial disease. Amputations or gangrene later on is a late manifestation or complication of diabetes. And obviously, pregnancy complications. Big babies are typically born from women who are diabetic. And that can actually impact on your delivery outcome when you deliver your babies or have your babies born. So how do you manage your diabetes? There are actually three parameters that we talk about. One is lose weight, eat healthy, and check your blood sugar. And this is basically an important measure to do because you want to be in control of your diabetes. So keep your doctor's appointments. We typically recommend in the beginning every 3 months to get your A1C or control down. And later on, if you've got everything under control, we say I can see you in 6 months. Lose the extra weight. If you are overweight, diabetes prevention may hinge on weight loss. Some of our patients come in with being overweight and are diabetic, and they beg or they ask if instead of going on medication, they can do diet change and weight loss. And sure enough, when they come back 3 to 6 months later on, they are they are down on their weight and their numbers just look perfect. It's all a matter of changing their lifestyle, their diet, and institute an exercise program. Every pound you lose can improve your health. Okay. it has been shown that participants in one large study who lost a modest amount of weight, around 7% of your initial body weight, and if you exercise regularly, this can reduce the risk of developing diabetes by almost 60%, a whopping 60%. So get active. It is recommended that you get 30 minutes of physical activity 5 days a week. I tell my patients if you're trying to lose weight, 3 hours to 3.5 hours per week. You can break that down to 3 times a week, or if you're able to do it every day, you can do 30 minutes 5 days a week. Research has shown that both aerobic and resistance training can help control diabetes. But the greater benefit comes from a fitness program that includes both. And the reason being, we want to recruit different muscle groups, and that can actually help maintain core strength and endurance, and also for the aerobic exercise, for example, running or walking briskly, that can improve your circulation and blood flow to the heart. So exercise can help you lose weight. It can help you lower your blood sugar and boost your sensitivity to insulin, which helps keep your blood sugar within a normal range. Eating healthy is very important. You want to eat healthy foods and include more fiber in your diet. I tell my patients, let's make sure that you are high on plant fiber. So follow a plant-based diet. Choose whole grains. Also, it also helps with reducing your cholesterol. So fiber, fiber, fiber. Foods high in fiber include fruits, veggies, beans, whole grains, nuts, and seeds. A high fiber diet also helps reduce your risk of diabetes by improving your blood sugar control, lower your risk for heart disease, and it also promotes weight loss by helping you feel full. So choosing your whole grains, very important to notice what are these whole grains. Whole grains may reduce your risk of diabetes and help maintain blood sugar levels by the following. You try to make at least half your grains whole grains. Many foods made from whole grains come from ready to eat like breads, pasta, and many cereals. Look for the word whole grain when you buy and read your food labels in the grocery. Make sure that it's among the first few items on your ingredient list. So reduce the amount of cholesterol. Choose healthier fats. Avoid saturated fats and choose leaner cuts of meat. Choose low-fat dairy and mono unsaturated fats like olive oils and canola oils. Eliminate trans fats. These are typically found in processed foods, fried foods. Trans fats increase bad cholesterol and lower the good cholesterol. Guess what else is in where you can find trans fats? Cakes and pastries, donuts, etc. Include more omega-3 fatty acids in your diet. They will help increase your HDL or your good cholesterol. This is typically found in salmon, mackerel, herring, walnuts, almonds, and ground flax seeds. I will tell you a little bit about what I tell my patients and counsel them. We look into LDL or your bad cholesterol and HDL, which is your good cholesterol. I tell them this is how you need to remember them. HDL, it's your good cholesterol. It stands for high density lipoprotein. It's also what you call the happy cholesterol, H. And the higher the number is, the better it is from protecting you from heart disease. So HDL, high density lipoprotein, happy cholesterol, and the higher the better. Whereas LDL, which is your bad cholesterol, it's your low density lipoprotein, it's your lousy cholesterol, L, and it's what's going to kill you. So it's lethal. Okay, so the lower the better. And those are found in your your rich foods in cholesterol like red meat. So other management tips include always take your medication. I tell my patients, turn the alarm on your phone or on your watch. So when it's time for you to take your medication, you know you're going to take it. Don't skip your doctor's appointments every 3 months initially, and later on, if you've been good, then every 6 months. get involved in a diabetes management program, which offers help from certified diabetic educators. We have a few in our clinic. Diabetes education classes, we also offer those in our clinic. And we also have registered dietitians. So how can I help prevent diabetes? Well, there's a lot of things we need to do. We need to eat better, diet. Okay, we become more physically active. If you want to lose weight, as I said earlier, 3 hours a week. If you're in maintenance mode, 2 hours a week is good. Losing a few extra pounds will go a long way. You look better on how you when you put your clothes on, and you'll feel lighter during the day. So these are important things. And obviously, what we are trying to achieve is that you do not end up with the complications of diabetes. Don't smoke. Okay, smokers are roughly 50% more likely to develop diabetes. So in summary, diabetes, there are two types, insulin-dependent diabetic or diabetes and non-insulin diabetes. Again, the defect is on the way insulin is metabolized in the body. Important keynotes to note is what are the symptoms, and make sure that you consult your primary care physician and you go for your annual physical where fasting glucose is measured. And then 3 things is diet. Make sure you're following a plant-based or a healthy diet. You exercise regularly is a second key point. And then the other thing here is get help from professionals on how to do this. Later on, all these things and trying to create a healthy lifestyle will actually prevent you from getting all the complications that we dread: heart disease, blindness, and kidney failure. That's it for today. There will be more webinars coming up, but I'm hoping that you were able to take home some of the salient points or important tips on recognizing diabetes, what it is all about, and how to prevent it. I'm going to hand off the mic to Kia, and she can help field questions if you have any. It was a pleasure speaking with you today, and I hope that as the holidays roll by, despite the pandemic, we will keep in mind how to stay healthy during this season.
All right, thank you so much, Dr. Davidson, for that excellent presentation. We'll now turn it over for questions. So give us 1 second while we go through them. So the first question that we have is, how does aging affect diabetes disposition?
How does aging affect diabetes disposition? I think it's such a broad question. I'm trying to find where that's coming from, but we know for a fact that as we get older, our bodies actually, our organs and the way we process food actually get older as well. I think the key here is if you are a diabetic and you feel like you're getting older and you're not able to manage diabetes better, is you keep in mind what has worked before in the past and what has kept you on the wagon of healthy living. Okay, so if you feel like a certain diet worked for you in the past, keep that. If you feel that your exercise routine is helping you maintain your diabetes or your numbers down, that's also important. But the main key here is you need to evaluate what you're doing day-to-day basis and keep what works, and that hopefully will help you manage your diabetes as you get older. I can do that. So the next question is a little bit in detail, and the question is, I gave birth to my first child on September 27, just this past summer. Okay, I was diagnosed with gestational diabetes. But during my last physical, which was before the delivery, my sugar was 74, which was normal, and my hemoglobin A1C was 5.7. Okay, Does this mean I have pre-diabetes? Yes. Okay. The question is yes. Based on your A1C, you were pre-diabetic at 5.7%, which means that when you had your physical, you were already pre-diabetic and then you had gestational diabetes. But I want you to know that these are all numbers. And what these are all mean is that we need to change the way going forward, your healthy lifestyle, keep your diet low in carbs, exercise regularly, so you can keep your weight down. Because I'm hoping that if you can change your lifestyle, you won't end up with being diabetic later on in life. I mean, we all struggle with food. I do. So I think if you're just able to get hold of what you should be eating, hopefully you won't become diabetic. And I hope that answered your question. So have faith and make sure that you're able to change your lifestyle.
Okay, are there specific fruits and vegetables that you should avoid if you're diabetic?
Yes, I think I'll go on from here. So yeah. So are there specific fruits and vegetables to avoid? Yes. Bananas are very high in sugar. Okay, so if you're going to eat big or large bananas, make sure that you cut them in half. Citrus, oranges, clementine, all of those are high in sugar. So make sure that you minimize those. Watermelon also is part of that list. So you want to make sure that you cut down on those. What is actually good and low in what we call glycemic index are the berries, blueberries, raspberries, strawberries. Those are low in sugar. Okay. So the next question is shrimp a good source? Okay, this is a good question. Is shrimp a good source of omega-3? It was in the picture. Actually, the best source of omega-3 fatty acids is deep sea fish. I tell my patients, I know we all love shrimp and crawfish and all the shellfish we want, but shellfish is actually high in triglycerides. Try to avoid those. What is really good is fish. Okay. So I mentioned about salmon and mackerel, all of those, and tuna. They're all good for source of fatty acids. Okay. Can we take nutrition class? Next question. Can we take nutrition classes at the Cyprus location without a doctor's prescription? Oh, thank you for that question. We are not set up yet at the Cyprus location. And I am hoping that in the future we can offer. We do have two endocrinologists over here, and we do have a diabetic educator. So if you go on the website, you actually can take a look at what we offer here. But thank you for the suggestion, because I'm going to push management to include classes here at Cyprus, and I'll be glad to be part of that education. Okay.
So the next question is it possible to get the slide deck or the recording of this webinar? So this webinar will be recorded. If you use the same registration link that you use to register, you can use that same link to hear the recording once we are done. About an hour out, then you can listen to it.
Okay. Next question. Can you reverse type 2 diabetes? A1C 6.7%. Absolutely. Okay. So remember, A1C is a number of 6.7%. Okay. I wish I knew more about it, what your condition or health status is, but yes, you can. I have patients who have come in and their A1C is 9%. And once we take them down through healthy lifestyle and living, exercise and diet, they revert back to normal or just pre-diabetic stages, and in a quick span of time too. I think it's more of educating our patients, and they actually just love when you explain to them that they're not eating the right food, and now they will take every effort to follow a healthy lifestyle. I have actually two new patients that came in with high A1C. They reversed the way they eat, and I've taken them off their medications.
All right, so the next one is, are you taking new patients?
We are taking new patients. Come and visit us here at Cyprus. Okay, we have several primary care physicians, and we all actually counsel our patients with diabetes.
Okay. What other exercises besides aerobic and resistance training for us over the age of 60?
Oh, that's a good question. I have quite a handful of patients who actually swim. They just love to swim. Older patients. Number one, it is not harsh on the joints. They do so a lot of our patients do yoga, Pilates, and a lot of my older patients actually do Zumba. I myself can do Zumba. I have two left feet, but I mean, I am blown away when my patients come in and they tell me what they're doing. It's I have patients in their 70s and then continue to do marathons and cycle. It's just a lot of what you are. This is what I tell my patients. If you want to choose an exercise program, choose one that you will know that you will stick with. Okay, because no use with you buying a Peloton or a treadmill when you're not going to use them. Stick to one that you will love to do. Very important.
Okay, aren't many of Kelsey doctors specifically qualified to treat diabetes?
A lot of the primary care doctors do. We go through a certain training program and are certified at the end, but we have quite a number of endocrinologists, and these are mainly the internal med doctors and specialists who specialize and went to training for diabetes. Okay.
Okay. How do you determine healthy weight? Is BMI used?
Yes, unfortunately BMI is the only way we use this, and I didn't go through this for slides, but body mass index is a measure of how thick we are. Thick, I mean thick, how fat. Okay, so it's based on height and weight. Up to normal is 20 to 25%. You can Google actually what your body mass index. There's a calculator that you can Google it with. 20 to 25 is normal, and 20 to 26 and up is overweight and obese.
BMI makes me sad.
I know BMI, and I tell you what, I'm an Asian, and BMI you have to add 3, and it's not fair. Oh, okay, yeah.
All right. So what about beans? We have many dinners.
Yeah, beans actually is under protein, it's under fiber, it's also carbs. And the only thing that I will tell you is if you are diabetic and you know how to check your sugar is do an experiment. Check your sugar before you eat beans and after and see what your sugar is up. But beans is a good way, it's a good fiber, okay, to incorporate. But I think you need to just monitor on what your sugar is on a yearly basis when you go for your physical.
Okay, so is there a correlation between diabetes and irritable bowel syndrome?
That's a good question. I don't think there is a direct correlation, but it may be the diet causing the symptoms of IBS here. So I think you need to find out what triggers your symptoms.
Okay. What is the best oral medication for diabetes? What about the recall on metformin?
A good question. Metformin is still the #1 choice that we have for newly diagnosed diabetes because it's been used for years. The recall on metformin recently was because of the manufacturing and the ingredients that they placed on it. So if you are on metformin and you did not get a message or call from your pharmacy, your metformin was probably manufactured in a factory where the ingredients were not harmful. So therefore, you need to make sure that you ask your pharmacy or pharmacist about what type of where your manufacturer was. Okay, but it's still the #1 use for medication for diabetes.
Okay, what are considered lean cuts of meat for pre-diabetics?
Lean cuts of meat. Actually, pork chop is okay. Take out the fat, trim the fat. Okay, so you're talking about red meat. We're still using your lean cuts of rib eye and roast. Just trim the fat. If you're looking at personal, I'm going to backtrack a little bit. We live in Texas, and a lot of men hunt. So deer meat is actually a lean cut of meat. Okay, so those are important things to think about. Okay, pork, red meat, and deer meat, they're all good. Goat meat is actually very clean and very lean, so that's also a very good source of protein. If you're thinking about personal sizes, if you look at your palm, turn it up, okay? Your size, your personal size of your meat should be your palm. Do not include, that's the size of your meat, the size of your palm. Don't include your fingers, okay? Because that will be a huge T-bone steak, okay? So just use the palm of your hand as a personal size for your red meat.
Why are African Americans more likely to be diabetic?
Yeah, I'm not sure exactly what, but it's probably genetics. And also, it's not just African Americans. I'm an Asian, so we are more prone to diabetes. And guess who else is Native Americans? There's a high incidence rate for diabetes, and it's all about genetic structure. I'm not sure, it goes way, way, I think, when their genes were made, and how they manage. Also, it's cultural as well. We typically have a high carb meal diet, African Americans, Asians, and Native Americans.
My stepdaughter was diagnosed with type 2 diabetes and later with type 1. Is this a common or to misdiagnose?
Yes, it is, especially depending on the age when someone is diagnosed. So if your stepdaughter was diagnosed with type 2 if she was in her 30s, and later on they could not manage with medications, oral medications, then most likely she's type 1. It's very common. So I don't think we need to do testing in terms of insulin levels in every patient, because 90% of our adult diabetic patients have type 2. So I think it's just keeping a close eye on and frequent follow-ups with your physician or primary care doctor.
Okay, we only have about 5 more questions, so we're coming towards the end. How does tension, stress, and anxiety impact diabetes?
A good question. How does stress impact diabetes? It's all about overeating. So all of us actually eat when we're hungry, when we're stressed, when we're happy, when we're sad, when we're celebrating. I mean, food for all of us is all of it, okay? So the way we see food actually is when we're stressed, we reach out for food. And therefore, if you are doing that, especially during this time of COVID pandemic, your numbers, your glucose levels may be higher than usual. You may have gained weight. So it's important that you know also how to deal with stress. Interestingly enough, before this diabetes webinar, I had another webinar on stress and depression. And I had to talk about how our relationship of overeating is because of stress. So it's important for you to be able to handle stress as well.
All right. So should everyone be screened for diabetes or only those with a family history?
Oh, no. That's a good question. That's why we encourage everybody to go for a yearly physical, because for a yearly physical, we do check you for diabetes. That's a fasting glucose, and if your body mass index is 27 and up, we also check an A1C, especially if you have a strong family history. So it's important for you to have yearly checkup for your blood sugar.
So this next question actually hits close to home. So what about us with PCOS? How do we control it as it is highly linked to diabetes?
Yeah, keep your weight down. So what about PCOS? It's polycystic ovarian syndrome, okay, and where you have a problem with insulin metabolism. So we put patients on metformin. Typically, patients with PCOS are also overweight. So all of this impacts on your risk for diabetes. So if you have PCOS, we need to make sure you're eating healthy and you exercise regularly to keep your weight down, because those are added factors leading to diabetes later on.
Oh, it's so hard with PCOS to get that weight off.
I know.
I struggle.
I think all of us struggle, PCOS or not.
And then the metformin is just,
Yes, I know, right?
Does high glucose serum indicate that we have high sugar?
Yes, so glucose and sugar are synonymous when you have diabetes. In other words, when we say you have high blood sugar, what is your glucose? It's the same thing, okay? So when we say check, did you check your sugar? That means did you check your glucose? It's the same thing, okay?
Can we sub fish with fish oil supplements such as the pills?
Yes, you can. If you want to do fish oil, fatty omega-3 fatty acids found in fish oil, you definitely can. I also use, instead of fish oil, I use flaxseed oil. You just have to read the label of the supplement, because what you're really looking for is omega-3 fatty acids.
Okay, and then our last question, are there supplements that can help with lowering blood sugar?
Good question. For those of you who are into the natural supplements, are there supplements that can help with lowering blood sugar? You know how things are very trendy. There was at one time we can do cinnamon. These are pills. And yes, I have seen patients lower their sugar with the cinnamon pills, okay? And then turmeric right now is the trend, and I don't have any big studies to prove that it lowers blood sugar. So I tell my patients, do an experiment. Let's see what your sugars are in A1C after you start taking your turmeric. There is a fruit actually from Asia. I can't remember what the actual name is, but it's mangosteen, and the supplement, or the derivative from it, is actually known for lowering blood sugar, and you can buy that from a health food store. These are things that come and go. And I tell my patients, I have no problem you taking this, but I need proof that it's working on you. So we need to do pre or before and after sugar readings and A1Cs to make sure that it's working, because I don't want you to buy all these supplements where they're not helping at all, because they can be pretty expensive.
Right. All right, well, thank you so much, Dr. Davidson. We all just received a quick lesson about diabetes and its management and what it means to have diabetes and what diabetes is. This concludes our webinar for this month. I want to thank you again, Dr. Davidson, for doing an incredible job today. And I also want to thank you all so much for joining us this month. Please make sure to register for next month's webinar if you haven't already. It is Happy Healthy Holidays, and it will be given by Dr. Guerra at our Baytown Clinic. So we'll see you all next month. Thanks.
Thank you.